Hi, it's Tammy, NZ Gastric Sleeve. I thought I would give you guys a bit of an update. So last time you heard from me, I had just been to the dietitian for my pre-op assessment. And in the process that my surgeon goes through, the dietitian, the counsellor and the surgeon had to meet to discuss me, and then a letter gets sent to my doctor. Nothing to me. Now this week I was at my doctor, so it took them 3 weeks to post a letter that they done and scanned on the day that I saw the dietitian, but 3 weeks to actually get to the doctor. But basically, I was a bit disappointed. I was hoping that it would just be, yep, she's been cleared for surgery. We'll make an appointment for her to see the surgeon and she'll get a date and go on from there. Nothing happens as you want it to, though. So basically, the dietitian cleared me. She was happy, but the counsellor had some concerns about my ability to stick to the diet. Therefore, they have asked me to go and see another dietitian, not the same dietitian that I saw as part of the assessment, twice, and to lose 5 kgs, which is 11 pounds, prior to being able to go back and see the surgeon. So their recommendation was to my doctor that they needed to then send a referral to my district health board to see a dietitian at my own district health board, because these operations are happening at a different district health board. The way the New Zealand medical system is a little bit funny. Well, it's not funny, but it'll be funny for you guys in America and Canada that have quite a different system. So here we do have a public health system that we pay for in our taxes, and anything at hospitals are generally covered. You don't get charged, you don't even get part charged. You pay for prescriptions, you pay to see your primary doctor. I pay $58 to see my primary doctor, New Zealand dollars, so that's more than that in US dollars. And there is private health insurance, and I do have private health insurance, but private health insurances don't pay for these surgeries. They will cover up to $7,500, which in New Zealand is only a third of what the sleeve is, which is why I have progressed down the public system. So for me to find out at my doctor that I then had to be sent to a dietitian at my district health board, I was a bit annoyed, because it takes 6 months to see any sort of specialist in the public health system. So I ended up contacting the surgeon's office directly and said, can I go to a private dietitian so that I could get that done and lose the 5 kgs that they wanted sooner than having to wait to see a dietitian through my public district health board. And they were okay with that, so I was quite happy with that. So with that means that I can kind of get the ball rolling. I contacted a private dietitian that one of the dietitians actually does work with some bariatric surgery patients, so that one works out well. I've got an appointment for the week after next, but have been put on the cancellation list for an appointment next week, so I can kind of get the ball rolling and get started sooner rather than later. So as you guys all know, I've been kind of doing this for a wee while, going down this track. Throughout that time, from when I first went to the information evening, I've been starting to go to the gym and getting more active. I've been tracking on my MyFitnessPal, and I have been kind of having between 1200 and 1500 calories a day through MyFitnessPal. So I haven't restricted, as in I've still had the odd McDonald's, but it's been within my calorie count. So it'll be a cheeseburger rather than a Big Mac. But I can tell from and I haven't lost anything over that entire period. Well, I've gone up and I've gone down and I've gone up and I've gone down, a couple of kgs at each kind of area. So for me to have to lose 5 kgs before being able to see the surgeon, I really need something that's going to stick. So I'm going to need to start doing something a bit more rigorous than just the calorie count. So I think I'm going to, what I've decided is until I see the dietitian, I'm going to basically start on what is the pre-op diet. So that's an OptiFast diet, which is made up of 3 shakes or bars a day plus 2 cups of non-starch vegetables. And so my plan for the pre-op diet was to have a cup of salad for lunch, and then like do something with the vegetables for dinner, with the rest of the vegetables for dinner, so that I was kind of feeling like I was still having meals as such. So what I'm thinking is I'll do that, but then add in some chicken or red meat or something into that salad and the vegetable dish at dinner time, just so that I'm having a low enough kind of calorie count to still lose weight, but still not on the base kind of pre-op diet of the OptiFast, because I don't know how long I'm going to have to be on it. I still don't know when my surgery is going to be. It'll likely be closer to Christmas, net with this coming up. So I want to be able to do something that I can stick to rather than 2-3 weeks of the kind of pre-op diet. So I'd be really interested to hear what you guys think of what I should be doing in that kind of space, and what I might be able to try to help with that, losing those 5 kgs. My aim is to lose it within September, so that I can be seeing the surgeon in early October. So that's my goal. Now I've got a couple of shout outs. Harry Draco Girl 1989. She would have had her surgery yesterday, so hope you're doing well. Also, I have to thank her for getting me onto iherb.com. I can actually get Quest bars in New Zealand, yay, because there is very little stuff that we get as far as what you guys have in the weight loss community in New Zealand. It's so frustrating. But I can bring in the bars. I can't bring in things like protein, like the pre-packaged kind of protein. And saying that New Zealand produces a good chunk of that kind of whey protein and dairy and that sort of thing. So I should hope that what I can get here is just as good, if not better, than what you can get on the shelves in the US and Canada. So I had an order arrive last week. So I was going to put an order in early, but I waited until the white chocolate and raspberry Quest bars were available. So I put in an order last Thursday. I was super impressed with the delivery. I got emails all the way through. By Friday night it was in Auckland. It took longer to get from Auckland to Wellington and then from Wellington to my house, each of those legs, than it did to come from the States. So big ups to iHerb, that has been fabulous. I did get it on the Tuesday though, so it still wasn't too bad. But like I said, it was here in Auckland on Friday night, but it still took a while to get to me. So in that I got 3 flavours of the Quest bars, 2 boxes each. I got some chocolate brownies, some chocolate chip cookie dough, and some white chocolate and raspberry. And I got some blender bottles. I love these. I saw them and just fell in love. I got 3 of them. I got it in red, pink and blue. The thought is to have one at work, one at home, and then a spare one. So yeah, that's really what's going on with me. So on Monday, I'm really going to be kicking into gear. Me psychologically need a little bit of time to come to terms that I'm going to be going on a diet. Because if I don't, I crave those foods that I'm not allowed even more. So having a few food funerals over this weekend, and are getting started on Monday. I'm also going to start travelling into work with a colleague of mine, and we are going to start twice a week going to the pools and doing some aqua aerobics, aqua jogging prior to work on 2 days a week, and then I'll still do my gym workouts and my oxygenome, which is yoga Pilates kind of combo. So don't think I need to add too much more exercise in other than that. So because I'll be going to the pools twice a week and then the gym 3 times a week. We'll see how that goes. I can always add more in if I need to. And then obviously when I see the dietitian, she'll give me a better idea of what I should be kind of looking towards. But I'm happy to open to suggestions. So please let me know what you guys think, to try and make sure that I do get these 5Ks off in the month, or 4 weeks would be better. But yeah, and I also thought that I would do a body shop because I haven't done one yet. All you've seen of me is my face so far, so I thought I would do that. I'm just in some jeans and a t-shirt today, but I will do some photos in some gym gear so I can kind of keep comparing them. I'll probably do that tomorrow so that I've got it before I start on this diet that I have to do before seeing the surgeon, and then I've got to do a pre-op diet, so it's a pre-op diet. Anyway, it's all losing weight, so anyway, yeah. Okay, so it's probably not the best clothes to really see. Side's probably a better indication. So tummy and bum, got quite a bit of back fat, which is a bit of an issue. Big thighs. These jeans are probably not the best to kind of see them in. It's the inner thighs more than anything. And yeah, the tummy, definitely 9 months pregnant. So side, back, other side. So as of this week, I'm 113 kgs. Didn't quite work out what that is in pounds. 240 something. So I need to get down to 208 before I can go back to the surgeon. I haven't been, not 208, 108 kilos. I haven't been under 110 in probably 7 years. So I think it's going to be as big a psychological kind of battle as it is the actual what I'm eating and exercise to get those 5 kgs off. But I am determined. I'm determined to do it because I want to have the surgery before Christmas. Basically, I've waited long enough. If I'm going into next year, then that's 2 years having to wait. So it's not that I don't think that's far away as far as the distance from now. It's the total kind of thing. And also, as I said in previous videos, one of the big things for me in losing weight is so that I can have a baby. So the sooner I have this operation, the sooner I can start working towards that, as I won't be able to try for a baby until after a year post-op. So and that's one of their concerns, is they're concerned that I'll have the operation and get pregnant straight away. So they are really pushing to make sure that I understand that. So, but anyway, I'm going to leave it there, just under 15 minutes. Bye.